The IL radiologic classification identifies the nodules by their size and the shapes. If the nodules are rounded opposites, they will call them PQR. The size was smaller than 1.5 micrometers, the nodules are P. Between 1.5 to 3 micrometers, they call the nodules Q. If bigger than 3 micrometers, they call it R. So when they talk about how many nodules in a patient, they call how many P nodules, how many Q, and how many R nodules. If the nodules with irregular shapes, they use S, T, and U to identify the nodules. And same as PQR, if the size smaller than 1.5 micrometers, the irregular opposite is called S. If between 1.5 to 3, the irregular nodules called T. If it is bigger than 3 micrometers, the nodules called U. So ST or U with the irregular opposites. Besides them, ILO also identify the profusion. They make it 6-point scales. You may see from this picture, they show 6-point scales of the lungs. This is lung areas. The left part has 3 lung areas. At the same time, the right part also with 3 lung areas. And depending on the point scales, they identify it to 0, 1st, 2nd, and 3rd degree. The 0 degree with no nodule, and the 1st degree with small quantity, and 2nd degree with further quantity, and 3rd degree with large quantity. For example, this patient, 3 lung areas were 1 degree, 1 lung areas was 2 degree. So the point scale were 2 degree, and the range were 4 lumps. The point scales will use the highest degree for the patient, and the range will put them together, all the lung areas together. So 3 lung areas plus 1 lung area equal 4 lung areas. For this patient, the range were 4 lung areas, and the point scale were 2 degree.